Hi there, my name is Karen Morse, and I am here to talk to you about the chronic disease I chose for my presentation, asthma. Let's begin. Asthma, also known as bronchial asthma, is a chronic lung disease affecting people of all ages. It is caused by inflammation and muscle tightening around the airway, making it harder to breathe. Although asthma can be a serious condition, it can be managed with the right treatment, and a lot of people can have very mild symptoms and can live a normal life with just a healthy lifestyle. Asthma affects more than 25 million people in the US currently, and this includes 5 million children. Asthma can be life-threatening if you do not get treatment. Sadly, some asthma symptoms can be confused with other illnesses, and this makes a lot of patients go on to be misdiagnosed or underdiagnosed for asthma. Some of the earliest records we have regarding asthma come from 100 AD. A Greek physician, Arctios of Cappadocia, listed the symptoms of asthma, including cough, difficulty in breathing, tiredness, and heaviness in the chest. He mentioned that the frequency of coughing increased as the condition worsened, and vice versa. So we have been studying this disease for a long time. What is an asthma attack? When you breathe normally, muscles around your airways are relaxed, letting air move in and out quietly. During an asthma attack, three things can happen. Bronchospasm, the muscle around the airways constricts, tightens. When they tighten, your airways are narrow and no air can come in or out. There is inflammation. The lining in your airway becomes swollen and again prevents that air from coming in and out. Mucus production, which is a a safety response of your body to create mucus to try to expel something that is not really in your lungs during an asthma attack. And because this mucus is so thick, it will clog the airways. There are two main types of asthma: the intermittent type, which is a type that comes and goes, to say you will feel relatively normal in between a flare up or an attack. You can go on to have a normal life without any symptoms or any flare-ups for years, and sometimes it comes up, sometimes it doesn't. The persistent type, which as its name says, it's more persistent, means that you have the symptoms pretty much all the time. They can be mild, moderate, or severe, but they never really leave you. Other types of asthma are more regarding the time and place of diagnosis for a patient. We have adult onset asthma, which is usually diagnosed after 18. Pediatric is also called childhood asthma. This often begins before the age of 5. It can occur in infants and toddlers, and some children can outgrow asthma, but it is still important that you discuss with your provider whether your child needs an inhaler. Exercise induced asthma, this type is also just called exercise-induced bronchospasm. It is triggered by exercise, as its name says. There is occupational asthma. This type of asthma happens primarily to people who work around air-trained substances, from chemicals to woodwork and other environmental allergens. We also have asthma COPD, overlap syndrome. This type of this type this type of asthma happens when you have both asthma and chronic obstructive pulmonary disease. Both diseases make it very difficult to breathe. What causes asthma? When when you have allergies, normally that can raise your risk of developing asthma. Environmental factors, as we mentioned before, from allergens, toxins, fumes, tobacco smoke, this can all be little things that can set off an attack in someone who has asthma. These can be especially harmful to infants and young children whose immune system have not finished developing and their lungs are still developing. Obviously, a factor is genetics. If your family has a history of asthma or allergic diseases, you have a higher risk of developing the disease. Respiratory infections, usually this cause is reserved for pediatric or childhood asthma, since children who experience viral infections, respiratory viral infections such as RSV, can have damage in their lungs that then will develop into asthma as they go into their teenage years and adulthood. The risk factors. Risk factors for asthma development encompass exposures throughout a patient's lifespan, meaning that it can be when you're a baby to when you are of old age. There is no one thing that can set it off. However, the most substantial known risk factor is atopy, which is characterized by the genetic tendency to produce specific immunoglobulin E antibodies in response to common environmental allergens. Nearly one-third of children with atopy will develop asthma later in life. Other risk factors are prenatal and perinatal factors, meaning that your child can develop asthma during pregnant or while in the uterus, meaning that if the mother is exposed to secondhand smoke, any environmental allergens, anything that can affect an adult can affect the mother and child as they go on. There's studies linking that if a mother is 20 years or younger, the chances of her child or baby developing asthma as they grow will increase, but they decrease once the mother is 30 or older. Premature births, children born 36 weeks at 36 weeks are more likely to develop childhood asthma. As mentioned before, childhood or infant asthma is developed through the same characteristics as adult asthma, allergens, secondhand smoke, your environment, really anything that can really affect your lungs will increase your chances of developing asthma. We also have occupational induced asthma, which is anybody who works with woodwork chemicals can develop this if they do not have the proper protection. Aspirate exacerbated respiratory disease is found in 7% of adults with asthma, and this happens when they ingest an aspirin due to the aspirin containing an enzyme that affects the respiratory way and can set off asthma attacks in patients. Sadly, there is no one treatment or cure for asthma. As we see in the image on our left, we have 4 different types of asthma drug therapy: relievers, controllers, preventers, and combinations. As their name says, relievers are short acting and help patients in the moment to try to stop or control an attack. Controllers, as I said, they help control or manage the illness long term. Preventers are used, again, as it's called, to prevent an attack. Combinations are 2 or 3 of the specific medications from relievers, controllers, and preventers together to try to help a patient. Other than that, the focus for asthma regarding treatment is patient education, making sure that they know how to respond to their body, how to listen to their body, at testing their asthma severity, see what kind of symptoms they have, what kind of exercises can we give them or provide to them for a healthy lifestyle to help improve their lung capacity or the lung function. Acute exacerbation is again looking into what kind of workouts can we do? What can your body do that will still keep you in a healthy place without an asthma attack? There's emergency department care, there is a magnesium sulfide therapy, and the last resort is intubation or non-invasive ventilation. And this is done once a patient is not responding to an oxygen mask and cannot maintain their level of a healthy level of oxygen. For the future, sadly, there is no specific program or public health program to prevent asthma. There are, however, multiple state and nationwide programs to track air pollution, and that is providing huge education to future generations of how our environment can affect us. We also have the Undo organization, who is dedicated to educating the public about the risks of tobacco, nicotine, secondhand smoke, and how all of this affects our lungs, and because of these items that are so mainstream in some way, are so normalized, people forget that because of tobacco or cigarettes, people develop asthma, COPD, cancer. Um, and regarding occupational asthma, we do have OSHA, the Occupational Safety and Health Administration, who has set out rules to help prevent this in employees. Your employer should tell you if you're working with any harmful chemicals. They should train you how to work with these chemicals, train you how to respond in an emergency, and supply protective gear from masks and respiratories. And they should offer extra training when you're working with a new chemical. All of this is done to prevent occupational asthma. How can I prevent asthma? If you smoke, quit. get vaccinated, avoid any aspirin or anti-inflammatory drugs, and losing weight or maintaining a healthy weight, it will help a lot to lower your chances of developing asthma. Here we have our citations. Thank you so much for your time. Have a good day.